platelet-rich plasma. Your blood contains these small discs called platelets, and along with the plasma, both are rich in growth factors and stem cell potential. These can be injected into damaged, injured, and arthritic knees, shoulders, the elbow, the hands and wrists, the spine, the cervical, thoracic, and lumbar, and pelvis, as well as hips and TMJ and jaw can all be successfully treated with PRP. The PRP is concentrated down with this special centrifuge. The finished product is the ultimate healing medicine made by your own body.
I was in a car accident, hit from behind in 1988, pregnant with my oldest daughter in the front seat. Saw it coming, turned to the right, arm out. Horrible pregnancy after that. Lots of pain. In 1992, I had neck fusion at C4 and 5. After the surgery, I started having pain in my neck, chronic, and it just got worse, worse, and worse. And in March, I saw an orthopedic surgeon who did MRIs, X-rays, and his recommendation was more fusion in my neck and some other issues with my lumbar. So I was facing surgery again. If they'd have told me that I would have ended up wearing out the disc above and below and back there again for surgery and back again in a few more years, and every time losing mobility and staying in pain. The neck fusion helped the nerve pain down my arm, but it's never helped my neck pain. And so I was just living in way too much pain. When I saw that you had all these different things on your website and all of them looked like they could help me, that's how I knew this was the place I needed to be. So I basically called, got the information, had the discussion with my husband, didn't tell the orthopedic surgeon anything, and talked to my best friend, and I packed up ready to come out here for as long as it took to get well.
So you moved here to treat with me?
I moved here to be here, to see you. Yes, yes.
Okay.
And to do everything that you're telling me I need to do.
Right.
To stay well, get well, and stay out of surgery. I have bulging discs and tears, and I couldn't sit, I couldn't walk, I couldn't stand, I couldn't lay. And you know, when you start to get used to chronic pain, my neck, I was somewhat used to it, but this was absolutely ruining my life. So the PRP, it was like almost immediate. The following day, I had such a release because it was just so tight and locked up and in so much pain. And as the time went on, the PRP therapy that I had, I could tell my hip was better every day, every day. Well, this along with everything else that I'm doing as well, but my hip, now I can sit, I can walk, I can stand, I can stretch it, I can do movement that I couldn't do before. And I'm really thrilled with that because that one was just really, really, really ruining my ability to do anything.
With her lumbar spine, you see that there's a positional problem between L4 and L5, and that vertebrae right here has slid forward over this vertebrae, and so the ligaments have been damaged there. And so what we've done is we've treated these areas with the PRP, treating the ligaments to support her spine, and we've also done some blocking techniques where we've had her use a wobble chair and do some blocking to reestablish the position of those two vertebrae. This is where she's had the fusion right here. See, these two vertebrae are fused, and then above that you can see that there's a stair stepping so that the third cervical vertebrae has slid forward on the fourth, and then you can see that we have even more severe stair stepping of C2 and C3. And so what happens is these vertebrae are fused. These vertebrae then have to work much harder to compensate for no movement here, and it wears out the ligaments. And so in that area of her spine, we've done some prolotherapy to regenerate the ligaments in these areas here to support the spine. One of the things that I show with a lot of patients is that this is demonstrating the movement of your neck, and you can see that there's some areas here that aren't moving, these three levels there aren't moving, and because those aren't moving, you can see that the red areas have to move a whole lot more to compensate for that. And that's what happened with you after your surgery, is that they fused these areas, but then it caused problems here.
I love the prolotherapy. I get almost immediate range of motion is the big one. Pain, lots less pain. But I was very limited on how far I could turn to the right specifically, and the Prolo has really helped with my being able to turn all the way, to the right without locking up. It was so bad that I had to help bring my neck back myself, and my neck feels so much stronger, and I don't wake up. After the first set of Prolo that I had was the first time in years that I did not wake up in the morning in horrible pain and have to slowly stretch everything and move everything. I had no pain. So it's made a huge difference.
You can reach us either by phone or you can log on to our website, advancedwellness.us. Or you can email me at askdrjl@gmail.com. And remember, if healing is possible, consider it to be within your reach. Bye for now.